when you were 27, did you think you were going to be where you're at right now and when you're 30?
No, to be honest. And they say, you know what, you have a couple options, but if you want to go to the best option, you have to go here, Supreme Dental.
And I was like, oh, the first thing I asked her was, is he good looking? And because she was asking me, like, you're going to interview all this. Is he good looking? Because she keeps on bugging me. And she said, yes. I remember I told you, hey, you want to be Michael Jackson? And you're just like, yeah, no problem. And I bought you the jacket, and you were like, oh, it fits perfect. And I've been watching some videos, but you never thought, like, oh, man, I'm going to be dancing right there, I mean, obviously, you were a great addition to the clinic. You are completely different, doctor, where you from. When you came in here, you're completely different than what you're now. Like,
yeah.
You're not even the same doctor. Welcome back to Supreme Dental Podcast Studio. You can be anywhere else in the world right now, but you're here with us, and we appreciate that. My name is Frank Navarro. My wife and I are the owners of Supreme Dental Clinic. Don't forget to like and subscribe. We also have a phone number and an email that you could call us. You could reach out to us. We have someone who is now taking care of all that. So there will be no missed calls, no missed emails. Remember, this podcast was meant for you, our patients. And today, we have Dr. Alonso here with us. How you doing, doctor?
Good, very good, very good. Thank you, friend. Thank you, guys. Thank you for introducing me. Thank you for all the time here. So we're going to start right now.
There you go. Perfect. So let's get right at it. So recently, I seen you in a video, and you were Michael Jackson.
Yeah, that's right.
I am very happy that you're a dentist. Because you're not a dancer.
I'm not a dancer. I tried.
You did a great job. I wouldn't have been able to do it.
We tried. But I think the video that was good.
It was a good video. The bloopers were very good also.
Yes, exactly.
But I wanna take some time. I'm gonna do these different segments with different doctors that we have. My wife asked me a question. She said, you know what, you always ask our patients, hey, how did you hear about Supreme? How did Supreme change your life? Mm-hmm. And obviously you guys are the ones that changed your life. The dentist, the assistants, the receptionist, anywhere from the shuttle, the experience, all the companies, the agencies that let them know about us, or social media, representatives. You guys all create this perfect atmosphere. George, who's right here right now on his phone, he makes these beautiful videos that shows patients what they go through here.
Yes.
And when they're here with us, we ask them, how did Supreme change your life? And they let us know, but we've never taken the time to ask our dentist. So now I'm here and I ask you.
Okay. Good question.
How did you hear about Supreme before you came to apply with us? And what made you apply with Supreme?
Before to come down here?
Before you came to Supreme Dental, what made you come and apply at Supreme? And what made you want to be part of this team?
I have in this town, around 4-5 years total here in this town. I'm from to Tijuana, the border with San Diego. So in the end of my career, I come down here, and I was working on it in dentistry, right? So always I have a good experience with all my last jobs, my last clinics, and always I am trying to have more experience. So I was working with another dentist. I was learning. I was looking the techniques and everything. But in one point, you need to go more go more up
To the next level.
to the next level, exactly. So in that point, I was looking something better. I was asked to my other partner, my other friends, and they say, you know what, you have a couple options, but if you want to go to the best option, you have to go here, Supreme Dental. So I say, well, we're gonna try it. Why not? We're gonna try it. And you're gonna remember that I was here like a couple years ago in the here outside the clinic, and like the first time when the receptionist, hey, how are you? I am looking the boss, but I think always you are busy. So the second time, 3 times, I think like 4 or 5 times I come down here.
So you applied 4 or 5 times.
Yeah, I think like 4 or 5 times. But yeah, in one point we have the opportunity to meet you, and that was great because we had a really good combination of we talk about all the experience before and everything. And 2 weeks later, you call me and you say, hey, you know what, do you want to be here, part of supremedental? And I say, yeah, for sure. So yeah, just that was my experience before to come down here. And always I'm trying to go to the next level. And right now here in Supreme Dental, I am very, very happy, and thank you for that. I mean, all the team and everything is great. And once you are here, you can change part of your life, because first of all, for the experience that you have with your patients, with the treatment plan, with the procedures. Here, all the dentists have a lot of experience by the time. Why? Because we have a lot of work. We see a lot of patients always, every day, and that is great. That is very. I think that's the most important to me. And well, we meet really good persons, a really good another dentist. We are talking about the procedures, what is the best option, the best option of the dental procedures and everything. So far, I'm really, really happy.
Welcome to Children's Dental Facts. Did you know that back in the day, your barber used to be your dentist? You heard it first at Supreme Dental Podcast. If you didn't know, well, now you know.
I'm gonna go back a little bit, and you had applied here 3 to 4 times.
Yes.
And the receptionist told me, Frank, this guy keeps on coming and leaving his resume. Are you gonna interview him? And I don't know what I was doing. Obviously we're always busy, but I was doing something, and I was like, oh, the first thing I asked her was, is he good looking?
Yeah.
And because she was asking me, like, are you gonna interview him? I was like, is he good looking? Because he keeps on bugging me. And she said yes. And I was like, okay. So I was outside eating a sandwich.
Yeah.
When I was eating a sandwich, I was vulnerable because I was hungry. And down came Dr. Alonso.
Yeah.
And then he came up to me and he said, hey, here's my resume. And I had seen his resume already. And I said, you want to interview? He's like, yes. So he sat down and then we interviewed.
I was very nervous that day. I remember it. Very nervous.
You were very nervous. I'm not going to go into detail, but you did choke up. You did choke up, and I was like, and you're like, this doesn't happen. I'm just very nervous.
Yes.
And I thought, like, hey, man, if he's choking up and he's very nervous, that means he really wants to be here.
Mm-hmm. Exactly.
So I seen your resume, and your resume was good. As good as a lot of doctors come in with great resumes, but just because they have great resumes doesn't mean we're going to let them in the team. And then when you come in, you're under, like, probation. We're testing you. We see how everything goes. The dentist that we had, normally my wife and I interview our dentist. I only interviewed you. I only interviewed several dentists, and so far, I think I've drafted right. My wife has drafted right, but I mean, obviously, you are a great addition to the clinic. You are completely different, doctor. That where you from? When you came in here, you're completely different than what you're now. Like,
Yeah.
you're not even the same doctor. Like, the way you did things were good, but we had our own ways of doing things. And you could have just said, oh, well, you know what? It is what it is. I do things my way. But you said, well, how do you guys do it? And you seen other doctors. And you learned and you opened up your mind and you said, you know what? Let's do it. And then you just kept on becoming better. And then All on Force came, which you were already doing before, but you have now a lot more practice with it.
Yeah, that's right.
And
That's
now
correct.
you just came back from Argentina not too long ago. You're going to go to Singapore next year.
Yes.
You've been to Thailand and you met people from dental departures that open up, to go over there and greet you. And that's awesome. And you even sent me a message like, hey, man, they received me here. Like, it feels good that I'm in the other part of the world and people are like, oh, how you doing? And, it was awesome.
Yeah, that was great.
And so very, very happy. But how has Supreme changed your life? I know you weren't expecting this podcast, and I just did another podcast, and he knew it. I told him, don't tell him. So how has Supreme changed your life?
That's a good question. Well, I think my supremedental right now is part of my whole life. Why? Because once you start to work here, you have to all like a 70%, 80% of your time is we have to spend a lot of time with the patients, making the correct things.
Yeah, the correct
The correct
work on the patients.
Exactly, yes. So sometimes we don't have a lot of time to have fun with family because
Personal life.
yes, exactly, because my family is, for example, is right there, is in Tecate, Tijuana area. So sometimes I can't go there, so my family they need to come here.
Visit.
Exactly. So and also, well, I think it's completely a different life after to start to work here. Well, for sure, another thing is we are working a lot here. We make a lot of treatment right here, like implants, the full mouth restoration, and everything.
You're doing nasal floor lifts now, right?
Exactly, yes.
And you're studying to do pterygoids.
Pterygoids. I'm learning to place the pterygoids.
Pterygoids. That's the next step for you.
Yes, exactly. So for sure, we work we need to receive something, right? And that's mean money. Mm-hmm. So you have to receive money to make your work good. So that was great because I have now the opportunity to go. For example, I love travel. I love travel. So now I can go to meet places. I never think that I can do that in the next year or in a couple of years.
You can go anywhere in the world.
Yeah.
Now the only thing you need is time.
That's correct. now the only thing that I need is time, exactly. And that is, I mean, like I say, that is good. I love my job. I love this place. And I think that's one of the thing most important in my life right now.
How long have you been with Supreme?
How long?
How long?
A couple years.
Couple years. like let's say you've been 2 years.
Yes.
3 years ago, before you were at Supreme,
Yeah.
3 years, would you think you would been where you're at right now?
Well, I think well, the experience. If we are talking about the working at the job, I think the experience, the treatment plans, that's the most
So
the big difference.
so 3 years ago, like right now, how old are you? How old are you? What's your age?
Oh, my age. Right now I have 30 years.
30.
Yeah,
So when you were 27,
27.
you were not part of Supreme.
No.
So from 27 to 30, when you were 27, did you think you were going to be where you're at right now in when you're 30?
No, no. To be honest, well, always I had the idea to go to the next level, like you say.
Mm-hmm.
Always I am trying to give my best in all in my life, in
Right.
all the steps
Anywhere
in
you
my
go.
life. Yes, exactly. With my family, friends, in the job, and everything. But that was. I was thinking that's gonna take more time to me, but once I'm here, I think I can go more fast.
You went fast.
Yeah.
Now, let me ask you a question. I know you work 6 days a week. I know sometimes you stay here very late.
Yeah,
You know, sometimes you're staying. I mean, crazy late. Sometimes I've seen the cameras and it's 10 o'clock at night, or even
Right.
longer, and you guys are trying to make sure that that patient's perfect before they catch the flight the next morning, or whatever it must be. Right? What motivates you? What makes you keep on going? Because obviously, you finish that week and those patients are gone, and now comes Monday, and it's brand new patients.
mm-hmm.
So what you did last week, it don't matter anymore. I mean, you have follow-ups, you have the second stages, but now you have brand new everything, brand new patients coming back, different worlds, different situations, all over again. What motivates Alonso to keep on moving forward?
I think the first point, I love my job. I love. Sometimes when I'm in home in my house, for example, I don't know, Saturday, and I wake up and I say, like I need that sensation that I am making something. And when I'm here working, making my procedures, changing lives, because we do that, I feel great. I feel very, very good. And I think that's the most important. Yeah, when you love your job, always is not something like a bad experience.
When
It's
you love
not-
your job, it's not a job anymore.
It's not a job, exactly. Thank you. Yeah, that is correct. And I think that's happened with me. And the second thing is because all the people have dreams. And, well, one of my dreams for sure is have a nice house, a nice home, travel for worldwide, give to my family the best. So I that's the second thing.
What does your family say?
They
What-
are
That you work so much.
well, yes, but they are happy. They are very good. Yeah, because they can see they can see all the changes in my life.
That's good. So that's
Yeah.
what motivates you. 'Cause
Exactly. Yeah.
You've had some you had perhaps the only patient that said, he didn't just change my life, you probably saved my life.
Yeah.
And we get patients. You said, actually, last 2 weeks ago, you said, I think my patient that I have right now doesn't just need teeth. I think she wants me to help her mentally, because mentally she needed someone there for her.
Mm-hmm.
And you told me, what do I do? Because you were like, I've done everything dental, and we talked a little bit, and you got some help also, but it was kind of like, Just listen what she has to say, and then change it up a little bit. It's she wanted. I remember what she said. I like my teeth, but I don't like the way my cheeks look.
Yes.
But we can't change that.
We can do that. Yeah.
We can't change that. Or if somebody said, "Well, I love my teeth, but I have all these wrinkles," we can't change that yet, because we're gonna start a Botox not too long from now. It's not a commercial, but if it was, I wouldn't be paying for it. Botox center's coming up, but it's beautiful what you guys do, and I know when someone leaves, and you guys feel that something was not right. And not something, because you guys make sure that everything fits and everything's perfect. But if you did not like the way that a tooth was shaped, but she has to leave, you guys stay with that. Like, hey, when you come back, we're going to change that. And the patient's looking at it and she's like, oh, no, I like it. But you guys are like, no, well, it doesn't look right. And that's when you really like your job. Mm-hmm. Because if not, then you'd be like, okay, well, here it is. And it is what it is. And that's it. But I've said it before, there's dentists that are made dentists and there's dentists that are born dentists. And I believe that you're a dentist that was born dentist. I'm sure that your family's extremely proud of you. We're proud of you also. You are one of the dentists that came in, and I've always told you, hey, man, we need to change this. And you're like, all right. Mm-hmm. Hey, talk to the lab. I need you to sync with the lab. And this is what I need some changes. And you're like, let's do it. Mm-hmm. I got you in with Dr. Elias, and Dr. Elias was on vacation. I said, we're going to go on pterygoids, and Dr. Elias says that, you're next. And you said, I thought you were going to say, no, I don't want to do it because they're not easy. And you're like, let's do it.
Yeah.
That's the next thing. So, you're always pushing yourself. You got a team that really motivates you. You got a team that pushes you. And I think that's the best situation to be in any career you have. Because if you're around a lot of people that just, oh yeah, you're doing great, then there's no growth. Mm-hmm. But if there's competition, but healthy competition.
Yes.
Competition, right. Like, hey, I got this patient, but there's something I can't do, and then somebody's like, well, I'm gonna do it, and then you could see me, or do it, and I'll be there with you, and then that makes you grow. And then you keep on going, and then you teach the next person, and that's why we say that our team Supreme, it's so strong, that it's so different. People come in that came to our clinic 2 years ago, and they said 3 years ago, and they say your clinic is so different. Everything is different about our clinic. Our doctors that we have here now they love what they do, and obviously we've had dentists that love what they do, but you could feel it. You could feel, you guys are crazy for doing videos of Dancing Thriller, and we didn't even train. Like, it was like, we're gonna do it right here, and let's go ahead and practice right here. and my sister was telling me, how did you get your team to dance? And I said, well, we're crazy to think about the idea, but you guys are crazier to say, let's do it. I remember I told you, hey, you want to be Michael Jackson? And you're just like, yeah, no problem. And I bought you the jacket, and you're like, oh, it fits perfect. And I've been watching some videos, but you never thought like, oh, man, I'm going to be dancing right there, But I want to thank you. I know yesterday you were extremely busy, and, we're recording this podcast today. You're a fan favorite. You're the only dentist that we've ever had at Supreme that a patient has came in, got treatment with another dentist, and then wanted to take a picture with you. Mm-hmm. So when they tell me, oh, well, there's a doctor that helped me, and I said, what did he look like? And he was like, well, he was tall, and he was, he was tall, and he was a brown, and I'm like, he was tan, and I'm like, okay, and I was like, was he good looking? And then if he says yes, then I know it's Luis. I'm just kidding. Obviously, it's you. But yeah, man, thank you so much for being part of the team.
Thank you, Frank.
Thank you so much for letting people know your story, coming from Tijuana, your backstory, how you met Supreme. We're happy to have you here. And thank you so much, guys, for watching. This was Supreme Dental Podcast. Is there anything else you want to say before we leave?
Well, just thank you all the patients to come down. Thank you, Fran. Thank you all the team. And well, I will be here for my patients for you. Thank you.
Have a good one. This has been Supreme Dental Podcast, and we'll see you next time.